Bismillahirrahmanirrahim. Assalamualaikum. Today we will present about the new public management NPM in the context of Ministry of Health Malaysia. Our group consists of 5 members, Muhammad Farizwan bin Mahmud, Muhammad Faris bin Wahdin, Nur Amira binti Ishaq, Syafina Desi Akon, and Sharifah Akila binti Syed Abdul Naha.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Farizwan bin Mahmud. We're presenting about the abstract and introduction for new public management of Ministry of Health Malaysia. This paper explore the implementation of new public management, which is NPM, principle within the Ministry of Health Malaysia. NPM represent a significant shift in public sector management towards efficiency, accountability and customer orientation. The Ministry of Health Malaysia has adopted various NPM practices to enhance service delivery, optimize resource allocation and improve governance. This abstract provides an overview of how NPM has influenced policy making, organizational structure and service delivery within the ministry. It examines the challenges encountered during implementation and identifies the key successes achieved. By analysing the Malaysian context, this paper contributes to the broader understanding of NPM's application in healthcare administration and offer insight into the effectiveness within the developing countries' public sectors. Key findings reveal that NPM implementation in MOH of Malaysia has led to improvements in resource allocation, service delivery, effectiveness and transparency through the introduction of key performance indicator, which is KPI, and strategic initiatives such as One Malaysia clinic program. However, the challenges persist, including administrative burden associated with performance measurement and the needs to balance efficiency gain with maintaining healthcare equality and quality. The next one is introduction. New public management is an approach to running public service organization that is used in government and public service institution and agency at both subnational and national levels. In recent decades, the Ministry of Health Malaysia has undergone significant transformation driven by the principle of NPM. Originating in the 1980s, NPM represents a paradigm shift in public administration, emphasizing efficiency, accountability, and responsiveness in delivering public service. For Malaysian Ministry of Health, embracing NPM has meant adopting practices from the private sector to enhance service delivery, optimize resources allocation and improve overall healthcare outcome for its citizens. Some key components, which is performance measurement, strategic planning, decentralization, and focus on result. So next is overview of NPM in healthcare. The objective is the dynamic landscape of healthcare delivery. The adoption of new public management (NPM) represent principle offer a strategic framework to optimize efficiency and improve service delivery. This objective is crucial in ensuring that healthcare organization can meet the growing demand for quality care while managing resources effectively. Summary of documented benefits by Pollard and Bokrat by 2011. Improving efficiency and service delivery in healthcare and other public sector organizations requires a multifaceted approach that integrates performance management, strategic planning and process improvement, technology adoption, employee empowerment and collaboration. By implementing these strategies, organizations can achieve operational excellence, deliver high-quality services, and effectively meet the evolving needs of stakeholders and communities. Next one is summary of documented challenges by Osborne and Gabler, 1992. Addressing issues related to equity and accountability is essential for ensuring that effort to improve efficiency and service delivery in public sector organization, including healthcare, are inclusive, ethical, and effective by prioritizing equitable access, fair social allocation, accountability, ethical conduct, and transparency. Organization can navigate complexities and challenges while delivering equitable and high-quality services to all individuals and communities.
Assalamualaikum, my name is Shafina Desi Apon, and today I'm going to talk about the literature review for this case study. New public management is characterized by the adoptions of private sector management practiced in the public sector, including the performance management, measurement, strategic planning, decentralization, and a focus on results. Several studies have documented the benefits and challenges of NPM in various countries, highlighting improvements in efficiencies and service delivery, as well as issues related to equities and accountabilities. NPM in healthcare, efficiencies and performance. Research indicates that NPM can lead to significant improvements in healthcare efficiencies and patient satisfaction. Table 1 summarizes key findings from various studies on the impact of NPM on healthcare efficiencies. For example, Farley et al. In 1996, a study in UK shows that efficiency improvements enhance resource utilization and service delivery. Meanwhile, in Aziz et al. 2016, a study in Malaysia shows that a better resource allocation and service provision can improve efficiencies. The potential downside include the risk of compromising healthcare quality and equity due to an overemphasis on cost cutting and performance metric. First of all, we're going to talk about the performance measurement. While performance measurement can enhance accountability and ensure that healthcare provider meets specific standard, it might also lead to a focus on easily quantifiable outcome at the expense of more nuanced qualitative aspect of care. For example, an overemphasis on reducing wait time could lead to a less attention to a patient-provider interaction, which harder to measure but crucial for a quality care. Second, cost-cutting initiative. Effort to reduce costs can result in a fewer resources for essential services, potentially leading to a decline in quality of care for less profitable services or marginal communities. For example, if budget constraints lead to staff reduction, patients might experience longer wait times and reduce access to special care. The third one is decentralization. Decentralization can make healthcare services more responsive to local needs, but may also lead to disparities if some regions have fewer resources or less capacity to manage their healthcare system effectively. This can result in uneven service quality across different areas. We've been through a case study from UKNH. UK National Health Services marked a significant reform aims at improving efficiencies and accountability. It was discussed the outcome of this reform noted substantial improvement in operational efficiencies, such as reduced waiting time, better resource allocation. However, they also highlight increased administrative burdens and disparities in service provision across different regions. For example, while some areas saw improvement, others struggle with maintaining equitable access to healthcare services amidst budget constraints and verify levels of local management effectively. Case study in Australia and New Zealand. Similarly, Australia and New Zealand has implemented NPM reforms within their respective healthcare services, aiming to achieve greater efficiencies and responsiveness. According to a study by May et al. In 2007, these reforms led to streamlined operation and cost saving in some areas. However, challenges emerged, particularly concerning workforce morale and patient equities. The emphasis on Cost-cutting measures and performance targets sometimes result in reduced job satisfaction among healthcare professionals and concern about the quality of care for marginals of rural population. Drawing on this international case, the Ministry of Health Malaysia can glean several lessons as it continues to implement NPM reforms. Firstly, balancing efficiencies and equity. Emphasizing efficiencies improvement must be complemented by strategies to ensure equitable access to healthcare services across different regions and population groups. Secondly, managing administrative burden, anticipating and addressing potential administrative challenges such as increased paperwork or bureaucracy hurdle is crucial to sustain positive outcome from NPM resource reform. Thirdly, learning from the workforce dynamic. Understanding and supporting healthcare professionals' needs morally is essential for maintaining high quality care at delivery amidst reform pressure. By integrating insights from this global experience into its own reform efforts, Ministry of Health Malaysia can better navigate the complexities of modernize its healthcare system under the frameworks of NPM. This approach not only enhances the likelihoods of success but also mitigates potential pitfalls associated with such reform.
Hi, my name is Nur Amir Ahmed Ishaq. Next, we utilize case study methodology. This involves an in-depth examination of specific initiatives carried out by the Malaysian Ministry of Health. By focusing on these case studies, we aim to provide a thorough understanding on how NPM concepts are applied in real-world settings. This approach allows us to uncover the challenge, accomplishment, and overall impacts of NPM reforms within specific healthcare programs or divisions of the ministry. Second, we conduct a literature review and comparative analysis. These components involves evaluating existing literature, official government publication, and policy documents on NPM reforms in global healthcare system. Our goal is to position the result from MOH Malaysia against the backdrop of international experience, particularly focusing on countries like the UK, Australia, or New Zealand. Through this comparative analysis, we aim to synthesize findings, identify common themes, variation in implementation, strategies, and derive lessons that could inform NPM practices in Malaysia. To analyze the qualitative data from our case studies, we employ thematic analysis. This method allows us to identify patterns, themes, and connections within the data, providing a deeper understanding of the complex dynamics involved in the implementation of NPM within the Malaysia healthcare system. As we conduct this research, we place a strong emphasis on ethical considerations. This includes obtaining informed consent from all participants involved in the study, ensuring their confidentiality and anonymity, and adhering strictly to ethical guidelines for human subjects research. However, it's important to acknowledge the limitation of the research design. Firstly, there may be potential bias in data collection and processing. Secondly, we might face constraints in accessing certain information within the Ministry of Health Malaysia. Lastly, the subjective interpretation of qualitative results is a common limitation in such studies. Our ultimate objective is to provide comprehensive insights into the implementation and outcomes of NPM reforms within Malaysian healthcare. By combining case studies, literature review, and comparative analysis, we aim to offer valuable findings that could guide future NPM practice in the Ministry of Health Malaysia.
Okay, Assalamualaikum. My name is Sharifah Akila binti Said Abdul Nahar, and today I would like to continue my part, which is finding and discussion of new public management in context of Ministry of Health Malaysia. Okay, has undergone substantial transformation through the adoption of new public management, which is aimed at enhancing efficiency, accountability, and service delivery within the healthcare sector. This section examines key findings from the analysis of NMP implementation in MOH Malaysia, drawing on empirical evidence and case study. Okay, first we have enhanced efficiency. Okay, it is one of the primary outcomes of adopting NMP principles. Within Malaysia of Health, Malaysia has the significant improvement in operational efficiency. Okay, according to the Muhammad in 2019, the implementation of performance measurement system has played a crucial role in optimizing resource allocation and enhancing service delivery. By systematically monitoring key performance indicators (KPI), it is his await times, patient outcomes, and operational costs. And MOH has been able to identify inefficiencies and streamline processes. This has resulted in more effective use of resources and improved responsiveness to patient needs, thereby enhancing overall healthcare efficiency. Okay, for the next issues, we have decentralization. Okay, decentralized decision making has emerged as another cornerstone of Malaysia of Health Malaysia, and it is highlight that decentralization has more empowered local health authorities, enabling them to tailor healthcare services more closely to the specific needs and priorities of their respective regions. Okay, this shift from centralized decision making to local autonomy has facilitated quicker responses to local healthcare challenges, and it was make more improved resource allocation based on local demand patterns and um, increase accountability at the regional level. And as a result, healthcare services have more become responsive, adaptable, and better aligned with community needs, contribute the enhance overall healthcare quality. Okay, next we have challenges in context of Ministry of Malaysia, Health Malaysia. Okay, despite this, the program progress made, the implementation of NMP in MOH Malaysia has encountered several challenges that warrant attention. From Aziz in 2016 identified that key barriers including resistance to change, limited resources, and concerns about maintaining equity and quality of care. Resistance to change among healthcare professionals and stakeholders rooted in long-established bureaucratic practices has posed challenges to adoption of new management. Um, it has practice and operational frameworks for frameworks. Okay, moreover, resource constraints, both financial and human, it is sometimes have necessities prioritizations of initiative and more careful allocation of resources, and it is often resulting in trade-off between efficiency gains and maintaining equitable access to healthcare services across different population groups and regions. It is more concerns from the financial and human, um, to sometimes want to limit it for the full realization of NPM's potential benefits. Okay, for the last, we have a discussion. Okay, for the discussion, it was findings that underscore the dual impact of NPM reforms within MOH Malaysia. It was highlight successes in improving efficiency and responsiveness while also acknowledging persistent challenges. Um, the enhancements of efficiency through performance measurement and strategic planning demonstrates tangible benefits in resource management and service delivery. Sometimes decentralization has empowered local authorities, fostering innovation and responsiveness in healthcare delivery. However, the identified challenges are particularly resistance to change and resource limitations, underscore the complex nature of implementing NPM reforms in a public healthcare context. Addressing these challenges requires strategic leadership, stakeholder engagement, and continuous adaptation of NPM strategies to ensure they are responsive to evolving healthcare and equitable in the outcomes.
Assalamualaikum. Thank you, Akila. Good day, everyone. Today, I will be presenting a case study on the new public management in the Ministry of Health, Malaysia, and their effective implementation of key performance indicators to enhance accountability and transparency in healthcare service delivery. Firstly, KPI has been instrumental in providing stakeholders with a clear benchmark to measure performance. This has not only improved transparency but also ensured that healthcare services are delivered efficiency and effectiveness. Key Initiative 1: Community Clinics. As of 31st December 2022, there are 239 community clinics established nationwide. These clinics play a crucial role in providing intermediate healthcare access to the population, thereby reducing barriers to the healthcare. This initiative exemplifies the Ministry of Health commitment to bringing healthcare services closer to the community and ensuring accessibility for all. Key Initiative 2: Emergency Waiting Time Target. Another significant KPI is the 2-hour waiting time target for the green zone in hospital emergency department. This target aims to decongest major hospitals by ensuring timely care for the patient with minor ailments. By setting this benchmark, the Ministry of Health strives to improve patient flow and reducing waiting times, enhancing the overall patient experience. However, with this initiative come with challenges. One notable challenge is the increased administrative workload associated with data collection and analysis required to monitor this KPI. Despite this, the benefit of improved accountability and service delivery outweighs the challenges. I will be also discussing the conclusion of our analysis on the impact of new public management or NPM within Malaysian Ministry of Health. First, let's look at the positive impact. The adoption of performance management system such as Key Performance Indicator or KPI has significantly increased accountability and transparency within the ministry. Additionally, strategic initiatives like the One Malaysia Clinic, known as K1M, have successfully expanded healthcare access, particularly in unserved communities. However, the implementation of NPM has not been without its challenge. Administrative burden remains a significant issue, complicating the maintenance of efficiency healthcare administration. Moreover, ensuring equitable access to healthcare services continue to be a pressing concern. Addressing these challenges require a continued commitment to reform and the strategic adaptation of NPM strategy. The Ministry of Health can build on the lesson learned from successful implementation, making sure that reforms are responsive to evolving healthcare needs. This involves actively engaging stakeholders and making targeted investment in healthcare infrastructure and workforce development. Looking ahead, sustaining the gain from NPM implementation demands ongoing refinement of this framework. By doing so, and by thoughtfully navigating these challenges, the ministry can further enhance the effectiveness and responsiveness of the Malaysia healthcare system. Ultimately, this will benefit all Malaysians. In conclusion, our case study analysis provides concrete examples of how NPM principle has been applied within the Ministry of Health, offering practical insight into the complexity and outcome of public sector healthcare reform. It underscores the transformative potential of strategy management practice in advancing healthcare delivery, while also highlighting the need for a nuanced and context-specific approach to reform. Thank you for your attention. That's all from our group. Thank you.